Hello and a very warm welcome to New Week right here on TV 47. My name is Leangari and our sign language tonight is Wairimo. You can engage us through our social media platform, that is TV47KE on Instagram, Twitter and Facebook. Remember tonight's discussion, we have a psychologist in studio. Her name is Edith Sakwa. And of course, our discussion today surrounding the impact that COVID-19 has on the mental health of people across the globe. However, let's begin with this story where the number of corona cases in the country is on the rise, with 11 more cases totaling to 208. This is according to the latest report from the Ministry of Health, which also indicates that 15 more people have recovered from the disease, pushing the number to 40. Take a look.
During his address to the nation, the Health Cabinet Secretary Mutahi Kagwe said of the 11 new recorded cases, 6 were males and 5 females.
In the last 24 hours, we have tested 674 samples. Out of these samples, 11 have tested positive for coronavirus disease.
As Kenyans online expressed their frustrations on the manner in which COVID-19 patient who died of the virus was handled Siaya County, Kagwe insists that the barrier rights have changed owing the pandemic, requesting Kenyans to adjust on the same. The ministry urging Kenyans to forgo cultural barrier norms.
I want to say in an honest term as I can, and be brutally honest, that our cultural practices on how we dispose the bodies of our loved ones may not be practical in an extreme situation. I therefore want our people to be mentally prepared and to accept that COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health barrier protocols.
Kagwe has come in defense of the members of Parliament, saying that his ministry has been working hand in hand with the Parliament over the corona pandemic in the country, despite of them not convening daily.
I want to acknowledge also, as opposed to popular opinion, that the role that has been played by Parliament. We have had engagements with the two houses, with parliamentary leadership and committees of both houses. These engagements have contributed to the overall response and intervention measures. As late as last week, we had meetings with the health committees who provided input into way forward, who provided support for how they are going to work in Parliament to provide funding.
However, he has urged the employers to be considerate and humane on the employees on the emerging cases of employers sending employees on compulsory unpaid leave.
To our employers, and to ask them to treat their employees in a humane manner. We have situations, for example, where employees have been sent home on unpaid leave. I appeal to the employers, even if you cannot be able to pay the full salaries that people earn, please consider supporting at least for minimum requirements of the household. Consider supporting your employees so that at least they can be able to put a meal on the table.
Elizabeth Mutuku, TV 47 Nairobi.
Thank you for that report, Liz Mutuku. Now, the National Assembly resumes its sittings tomorrow, though unlike the previous plenaries, only 53 members will be allowed in the chambers. Now, according to the National Assembly Speaker, Justin Muturi, members with underlying health challenges and as well as members aged 58 and above are supposed to work from home. And well, thousands of healthcare workers across the world have put their lives and those of their loved ones at risk in a bid to contain COVID-19, the now global pandemic which has put the Kenyan healthcare system on the spotlight. In light of this, the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has called on the government to first track the actualization of the measures being put in place to curb the disease. Tracy Mukami explains why.
Every day, health practitioners show up for work without the necessary personal protective equipment, commonly known as PPE. They risk contracting the deadly coronavirus. A delay in the provision of the required armor has seen 14 healthcare workers in Kenya infected with the disease.
It's 4 doctors who have confirmed positive. We have 10 nurses, 10 clinical officers, and over 70 other healthcare workers under quarantine as we speak, who are on the front line handling the patient, those who have been put in mandatory quarantine and those in the hospital.
The Kenya Medical Practitioners, Pharmacists and Dentists Union has urged the government to ensure that healthcare workers are well equipped to fight the war against coronavirus.
We must remember all the time to protect the frontline soldiers. Even when the army goes to war, they are given equipment, they are given instruments to go fight. We are sending our healthcare workers to the field empty-handed.
While several measures, including a directive to hire new personnel, have been put in place, KMPDU has requested the government to fast-track the recruitment of additional workers, citing fatigue. A press statement by the organization reads, "The teams on the ground have started undergoing burnout due to long working hours, relatively few healthcare workers, and the need for provision of accommodation to protect their families." The board proposes that the Public Service Commission shortens the recruitment period to enable employment, training and deployment of workers within 14 days. The organization calls for addressing of unresolved issues between county governments and healthcare workers. Various proposals by the board include the creation of an occupational injury and disease fund to cover all frontline workers, relief of payee for all healthcare practitioners for 12 months, and provision of COVID-19 allowances. Currently, over 70 healthcare workers are in quarantine due to the exposure to COVID-19. For New Week, my name is Tracy Mukami.
And well, in a span of about 1 year, coronavirus has hit nations mercilessly as deaths continue to be reported. America, a superpower, is on the ground despite warnings and predictions that saw some of its leaders come up with measures and policies in preparation of dealing with such pandemics. Now, African nations are as much on the scale. And as the fight takes a new shape, causing global economic downfall, we ask, who is to blame? Our reporter Paul Kirobi reports on some of these events.
It is a virus that has vehemently caused a headache among doctors in the process of finding a vaccine as different nations continues to find an escape route and doing research to provide an antivirus. The virus has already caused a panic, setting the economic status of different countries in limbo. United States of America, a nation that is an economic giant, is now feeling the pinch, even after those in power predicted the possibility of this pandemic and insisted on preparedness. George W. Bush, former president of America, echoed on this, giving his proposed mechanism on how to deal with the situation.
Leaders at every level of government have a responsibility to confront dangers before they appear and engage the American people on the best course of action. It is vital that our nation discuss and address the threat of pandemic flu now. But if we wait for a pandemic to appear, it will be too late to prepare. And one day, many lives could be needlessly lost because we fail to act today. By preparing now, we can give our citizens some peace of mind, knowing that our nation is ready to act at the first sign of danger.
President Barack Obama categorically stated that times will come when the nation will receive a pandemic, and in this, the country will have to be adequately prepared.
There will come a time in which we have both an airborne disease that is deadly. And In order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. So that if and when a new strain of flu, like the Spanish flu, crops up 5 years from now or a decade from now, we've made the investment.
That time is here, and the incumbent Donald Trump is sitting on a hot frying pan, climbing a tower that has no end, facing tough times in finding a solution to this virus.
Nobody knew there'd be a pandemic or an epidemic of this proportion.
Crossing over to the African continent, Kenya has not been a special case as the fight continues to cause mayhem in the country. Leaders and the common mwananchi pointing an accusing finger at each other. The biggest question being, when did the virus fly into the country and why were proper measures not taken? Reporting for TV47 News, I'm Paul Kirobi.
Well, politics now finds its way back since the country announced its first COVID-19 case on March 13th. As has been the norm, the politicians are at it again. The squabbles in Jubilee Party are far from over, or even worse, close to crumbling the party. After the Deputy President William Ruto crying foul on the proposed leadership changes of the party, some members now insist that Ruto should shape up or ship out.
The clarion call has been that every other activity in the country gets to a standstill, including politics, a move that saw BBI rallies postponed with the aim of all joining the government on dealing with COVID-19. It has been a month since, and the politicians could not stand the silence. Deputy President William Ruto is on the headlines this time round, castigating claims that Jubilee had plans to make changes on its structure. According to him, those who purport to execute this are fraudsters. This was after a Gazette notice was published on 6th April 2020 and the information presented to the Registrar of Public Parties, Anne Nderitu. Jubilee Secretary General Raphael Tuju, however, reiterated that the changes were necessary and were proposed with the directive of the President after some Jubilee officials landed job positions in government. The question then is, how possible is it that such crucial decisions would be made without the knowledge of the Deputy President, who is a senior official of the party? Analysts argue that Jubilee Party is headed for shambles. Tanga faction continues to point a finger at the President for what they claim is a sideline of his deputy. Nominated Senator Millicent Omanga on her Twitter page has also challenged the decision. ODM leader Raila Odinga recently insisted that a referendum is inevitable and the BBI campaigns are set to resume as soon as the country is done dealing with coronavirus pandemic.
Well, that story brings us to a short break. Remember, you can engage us through our social media platforms. That is TV47KE on Instagram, Twitter, and Facebook. Remember again, tonight's discussion, we are looking at the mental aspect of COVID-19's impact. Basically, what is happening to people, the stress, the anxiety, what can you do to deal with it and overcome it? And of course, as I mentioned, we have a psychologist on standby. We'll be speaking to her on Skype. So don't go too far. Remember, you can shoot all the questions you may have for tonight. So don't go too far. New Week will be back shortly.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Hey, Sospita son, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deed spare. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today.
Si nilikwambia. You are a big smart joke.
Mwananchi Credit. Investor in people.
My name is Sujata Kotam Raju. I'm the National General Secretary of Hindu Council of Kenya. Namaskar to my dear sisters and brothers. Now this is the time everyone will have to take the responsibility to fight against this virus, not to spread further in this country. If at all, if you want to go out, maintain the social distance. Avoid going to the enclosed areas like supermarket, temples, churches, any religious functions. Avoid shaking your hands and hugs, any form of physical contact. You can just say namaste. For more information, dial 719 or *719#. Kamesha Corona.
The coronavirus pandemic has not just infected thousands of people around the world. Sadly, thousands of people have also lost their lives.
The virus is here in Kenya, and unless we do something about it, thousands may die.
Our healthcare system cannot bear the burden of this virus.
If too many people become infected, we all know that our healthcare system will not be able to handle the pressure.
We stand to lose many, many lives.
You, me, or our loved ones could lose our lives.
To avoid this from happening,
you and I have a part to play.
Sanitize your hands.
Wash and disinfect your hands regularly.
Wash your hands frequently with soap and water.
Don't touch your face.
Please observe social distancing.
Avoid going out of town or being in groups with so many people.
And most importantly, you must stay at home.
Please stay at home.
Stay home.
Don't go out to meet with your friends.
Stop your children from going out to play in groups. In fact, limit anything that takes you out of the house and follow government directives.
Please let us follow government directives.
Stay at home.
You must stay at home.
Dear Kenyans, stay at home and save lives.
Stay at home
and save lives.
Stay at home and save lives. I beg.
Stay at home. Let's stop the spread of coronavirus.
Care for me as I care for you, and together we will beat this thing.
Stay at home and save lives.
Welcome back. If you just joined us, you're watching New Week right here on TV47. Remember the Twitter and all social media handles that you can reach us through. That TV47KE on Twitter, Facebook, and of course Instagram. Remember, tonight's discussion, we are looking at the impact of COVID-19 as far as mental stability is concerned. We're talking about stress and different things that people are dealing with. And of course, as you can see, we have Edith Sakwa, who is a counseling psychologist, a very much experienced psychologist, I must say. You know, Edith, looking at the situation nationally and also globally, you will see people are so concerned. Some are living in fear right now. Some of them look like they're in anxiety. But I just want to get the picture from you, because I know you've been working with a little bit of, information from the ground from your colleagues and whatnot. So what's the situation like right now? Your thoughts on the current status of mental effects as far as COVID-19 is concerned?
Thank you very much, Leah, for this opportunity. I want to say that as a country, we have gotten into a state of mental health crisis, and this crisis is posing a lot of dangers to the health of the population. The reason why I'm saying that it's a mental health crisis, it's because when we look at COVID-19 as a disease, it is presenting itself in physical symptoms, whereby the doctors are able to manage and see how to cope with it. But when it comes to the psychological symptoms, they're rarely picked up very fast as we can pick the physical symptoms. Therefore, we will say that psychological effects of COVID-19 are too much, are very rapid, and a lot of people are in a state of despair. A lot of people are in a state of confusion. When, for instance, when we look at the physical symptoms, we'll say that it only comes to the infected people. But for the psychological effects, it affects the entire population. Whether you're infected or not infected, you equally feel the patch of the psychology. Mm-hmm. And also, as much as we all feel the same, will not be affected in the same measure. So some of the major things that I would say I've picked from interacting with the population in different levels, I would say stress levels have really gone high. A lot of people are living in fear because of the uncertainty. They don't know for how long they're going to continue with this state of the tension. They don't know whether the people they are interacting with are infected or not. And therefore, the stress that people are going through is equally affecting the physical, the physique. For instance, when you are in a constant state of stress, the body has to develop a coping mechanism by producing some chemical reactions to be able to cushion itself from danger. And when it develops these chemical reactions, these are things that we call hormone or the stress hormones. They tend to affect our mental process. They tend to affect our emotional process. And also I want to say that as the body cushions itself, if this stress is prolonged for a long period of time, then the body develops a lot of complications which could be maybe, for instance, people might end up getting clinical depression. People might become suicidal because of the many challenges they're going through. Maybe just to give an example.
Edith, before we go too far, you're mentioning very critical things there. And you're talking about the fact that people may develop depression. You're talking about anxiety, a lot of stress levels. Thank you for that explanation on what actually happens to the body. Let's just begin with this particular people who are actually in self-distancing, they're in isolation. Some of them can't leave the house. They're used to getting out of the house, but then right now they can't get out of the house. How do you avoid, what are they supposed to be doing right now, Edith, so that they're not ending up into the point of becoming depressed or living in anxiety? How can they deal with their situation as it is? These people, the ones who are in isolation and self-distancing right now.
Okay, knowing that this disease...
And here, Edith, we're talking about the people who haven't tested positive at all. They're just basically taking steps to protecting themselves.
It can be very difficult, especially for these people that are living in isolation or they're quarantined and haven't even tested, not knowing their status. Could be a lot of anxiety, as we say. but also because we want to help these people cope with the state they're in so that they don't develop into more complicated health concerns. I'll say that it's important for us to understand that there is a difference between social distancing and social isolation. That as much as these mechanisms have been put in place for us to distance ourselves from other people, we can as well create connections with our loved ones. In terms, we have digital platforms whereby we can call, we can WhatsApp, and we can have a very healthy relationship with the people that we are not being able to meet face to face. Therefore, just understanding that we don't have to isolate ourselves per se as we distance ourselves. And another thing, even as we are in this state, we also need to reach out, especially to our neighbors, and see how well can we even help those people who are in need. As I can be helping my neighbor, it seems like you're helping someone else, but in itself, it has a positive impact on your mind because it helps you to also produce this good feeling hormones, such as oxytocin. They help you when you do something good to someone else, you feel good. I would also want to encourage the people that are in houses are used to attending to other activities to involve themselves in physical activities. I know there are many activities around this place now, and especially when you go to the social media, instead of engaging into information that is not helpful, you can get activities such as exercise.
When you talk about physical activities, I must say that earlier on I was looking at what's happening online, and I happened to come across this video. Actually, it was a story from Nigeria where people were actually engaging in the kind of exercise you're talking about. People were running around, people were in a field, and they were helping each other do some certain, movements with their legs. I think we need to know when you're doing some activities, what are you supposed to do? What kind of activities do you do that allow you to still observe some sense of social distancing? Because what I saw with a story from Nigeria, there was a little bit of compromise in terms of, making sure that the measures are being observed.
Yeah, physical activities, as you say, we also need to be very careful to ensure that we maintain the social distancing. For instance, when you at home with your own family members that you've been watching yourself very carefully, and these are people that could not be prone to whatever is happening, I would suggest that activities that are more relaxing in nature. For example, you can have watching movie together. You can have relaxation activities in terms of meditation, in terms of praying together. You can skip, you can, dance. There are a lot of activities that can be done within the homestead without going outside to connect with other people for you to do them.
Wow. So when you talk about, Edith, I'm trying to imagine someone has been doing Netflix for about 2 weeks and they're literally bored. Maybe they've been playing cards, and you can't play cards for the longest time. I mean, is there anything else? I know people are asking, what else can I do to make sure I don't get bored and end up feeling depressed about the current situation?
Yes. Yeah, for me, I'll call for people to be more creative, because you see, what works for me may not work for you. And creativity can apply in many areas, especially in our lives. You can start from the kitchen. People are now coming up with different recipes of even cooking and just having fun. People are having even visiting these traditional activities like play games that they used to do when they were children, and you see now our current children now have no idea what the parents used to do. And I've seen a lot of people come up with these old games, skipping and playing this they call in Kiswahili kati. So they're very creative in their own nature, because if you wait upon maybe someone to dictate the activity that will work for you, it may not really work. So I'll just request people to be more creative and also to take it deliberately. It should be purposeful, that whatever I'm doing, it's not just to pass the time, but also to help me learn from this experience, help me to bond with my family members. So there must be a reason why you're doing all these sorts of activities, not just for the sake of passing time or breathing boredom, but there should be a meaningful purpose to the activities you're engaging in as a person and as a family.
Edith, you mentioned children there, and one of the things I also wanted you to talk to us about is how to communicate to our children. I mean, they're very sensitive little human beings, and they need to be told in an understanding way, why are we in the house, what is happening with COVID-19. How do you speak to your children about the current situation without causing any unnecessary alarm? What kind of language are we looking at?
Yes, it's important because our children are in the house and most of them are asking a lot of questions on why they're not going to school, why they're not going to play with their friends. I would say that it's important to be able to break this information to age. It should be age friendly, like now below 10 years, below 12 years. These children, the information needs to be very clear and without threatening information that can scare them, because now if the information is overwhelming for the child, it also affects them psychologically, and this can manifest in their appetite, it can manifest in their sleeping patterns. So it's very important that as a parent you first need to understand what it is before you get to a level of explaining to the children. And when you explain to the children that they're not supposed to go out to play, you have to provide an alternative. Children want to learn when they're engaged. Children will learn to, they appreciate all these rules that are laid if also as a parent you observe them. So, you know, the biggest challenge our children are facing is when parents are saying, don't do this, and we go contrary to what we are telling our children. So I would say at this time we want to learn to get to the level of that child, look at life from the perspective of a child. Because for them, the things that are happening now may not really make sense. There's another child that was telling me the other time that people are dying because of COVID, and whenever they see CS for health, they call him to corona. You see, so the information needs to be very child-friendly so that it doesn't cause a lot of harm to them psychologically.
You know, when you talk about mtu wa corona, and I bet some people are actually putting that kind of language out there to their children, that almost creates a sense of discrimination for people who have tested positive. I mean, what kind of language should we use, not just with our children, but also with just, you know, our peers and anybody else about coronavirus, about people who have tested positive? What kind of language is suitable that is not harmful to the person who we're referring to or to the situation itself?
Okay. First, I would want to say that we need to be very empathic in our response. We need to know that these people that are infected, they didn't do anything wrong for them to have been infected with this COVID-19. And therefore, we want to refrain ourselves from calling them COVID-19 victims. For instance, calling them, you know, the way someone would be having malaria, there's a way we just call them, they're just patient. He's a person before even the condition. But now if we want to attach the condition to the person and make them be stigmatized because of what they're going through, then that can also create a lot of harm to these people that are infected. So calling these people victims, I think this is a common language that we are using, but it won't come out well for the patients who are.
Hello? Well, we seem to
okay. Very smart, yes, or unique. It can get anyone.
Okay, we had lost you there, Edith, but we are glad you're still on. Well, just moving away from, you know, the language that we're supposed to use and how we're supposed to speak to our children, I want us to look at those people who have lost jobs, Edith. How do they deal with this? Some of them have lost jobs. Some of them, their businesses, in terms of profits have really dwindled. I mean, how do they deal with all these issues, all this pressure that's really coming down to them because of the current situation?
Yes, yes. I want to say that first, as a country, we are all grieving. As a country, everyone is grieving because everyone has lost something in this process. It's either you've lost a job, it's either you've lost a sense of security. There's loss of sense of security. There's loss of a loved one through death. There's loss of health. There's loss of financial security, as you say. So I would say that everyone, especially during this period, are processing a grief. They are mourning over a lost thing. And you see, when we say grief, it is an intense emotional reaction to a loss. And when people have this burden in with them in terms of losing something, it is very complicated. It's very hard. Especially the ones, let's look at the ones who've lost, for example, the loved ones. It is a bit difficult for them during this time because naturally when you lose a loved one, you really rely on social support. You really rely on people to come here, to come there and be there as a support system to offer you solace. But with the mechanisms that are put in place, you find that people are restricted even in visiting these patients who are still in the hospital. You can't have time to even talk to them. You can't have time even to make amends.
Well, it
was
is
their last days on earth.
Well, so yes, as you mentioned, all these very strong instances of people who have lost their loved ones, people who have lost jobs, people, you're talking about the fact that this situation as it is, we are all dealing with grief in one way or the other. So then how do we begin to deal with this grief? What's the way we can deal with it?
So how do we cope with this loss? As I said, the myriad of losses that people are processing. First thing I'll say that maybe just to encourage each and every person to have a chance to just share the experiences with anyone. Sharing experiences of a loved one, sharing experiences of how your job has been, it really helps someone to be able to come to terms with what is happening. So it's very important for people to just open up and share the experiences, share memories of what they've lost, because it's a part of them that has been taken away from them.
All right.
Say that maybe we should not be got in a guilt web, because at this point you find that a lot of people are going to feel guilty for what they did or not, or what they didn't do concerning what has been taken away from them. And for example, say that a lot of people are going to have the survival guilt because when, for example, in a family, when all of you are infected and one person passes on, the rest of the people that are remaining might get themselves into a guilt, a survival guilt, because they are looking at themselves and they think they don't deserve to be alive. Another thing that I would say in terms of grieving is it is normal to feel the way you're feeling, just to normalize this feeling that, yes, when you lose a loved one, when you lose a property, when you lose your health, it's normal to feel the way you're feeling, unless it is prolonged. When it is prolonged to at least more than 12 months or so, we would want to say that now this is a complicated grief and there will be need for intervention, for an expert intervention to help this person come out of this. And a very important thing that people can do at the comfort of their homes is to keep journals. Journals are very effective in processing these losses, and they help us to track the thought process, they help us to track our feelings, they help us to track experiences and come to terms with what is happening. So keeping a journal is very, very important for each and every person, especially during this period.
All right,
time that we are.
Edith, I want us to take a short break. When we return, we want to look deeper into the different people who have been affected and how they can deal with the situation, coping. You've talked about children, and of course, you've talked about people who have experienced loss in one way or the other. Right now, New Week will take a short break. Remember to stay tuned, and if you do have a question for Edith Sakwa, remember you can write to us through our social media platforms. That is TV47KE on Instagram, Twitter, and Facebook. Don't go too far. We'll be back shortly.
electioneering period comes with promises. Promises that sometimes are just meant to get you buy-in.
In this year's program, we've said we are going to double the subsidy. We're going to make fertilizer even cheaper. From 1,800, we're now going to take it down to 1,200.
On Pledge Watch, what happens after Mheshimiwa gets that seat is our core business. We will ask those tough questions, and where the promises have been delivered, we'll be here to celebrate the achievements. Pledge Watch, where a promise is indeed a debt. Join me, Linda Alela, every Tuesday at 9 p.m. as we get to ask these candid questions only on TV 47.
Hello and a very warm welcome to TV 47. This is New Week. Remember tonight's discussion, the impact of COVID-19 on the mental status of people across the globe and of course the nation itself. Edith, if you can hear me, can you hear me?
Yes, I can hear you.
Hello?
Hello?
Oh, you can hear me. So
Yes.
Edith, as we were talking about the impact of COVID-19 on, different people, we're talking about job losses and people who have been affected. I think before we move away from this, there are people who have lost their loved ones, Edith. And some of these people have not even had enough time to grieve their loved ones. As you know, some of the African communities, even the Kenyan communities, they take a couple of days to grieve their loved one. But in this case, the loved one is buried within 24 hours. How do they deal with this? Hello? Edith? Hello?
Hello?
Did you hear my question?
I'm losing you.
Sorry about that. So I was saying this.
Yes.
That there are people who have lost their loved ones. As it is right now, they're not having even enough time to grieve their loved ones because they're buried within 24 hours. How do they deal with this harsh reality of the circumstance as it is?
Yeah, I want to agree with you that it's quite devastating at this moment, that we've been given guidelines or measures on how to observe, especially when it comes to death and funerals, that people are supposed to be buried within now the 24 hours, and even the number of people attending the funeral are restricted to a maximum of 15. It is stressful in itself, and I would want to say that maybe from the African cultures, we really appreciate having a good time in terms of setting a befitting send-off for our loved ones, but now we have not that option. So what is it that we can do to help us at least be able to manage with what we have? I would say that, of course, with the use of digital media platforms, maybe friends can help the bereaved family even from a distance to just help them have a plan of the funeral arrangement, even if it's brief. And also, maybe after the burial, people can have a time just for themselves to be able to mourn, because if what I'm seeing currently is there'll be a lot of people postponing mourning. There'll be prolonged mourning or grieving that will come even after many years that we've passed. When we passed COVID-19, people still be grieving. So I would say that if people are able to just take time in their own rooms, in their social connections, just to be able to talk about what is happening and be able to process these losses. But above all, it's important to seek for help. I'm saying this because there are a lot of psychologists outside here that are looking to come in and support a lot of people that are going through these losses. We know they cannot manage on their own, especially without their family members, without their friends. So for me, I would say people should be free enough to reach out to counselors, to psychologists, to be able to come up, to help them to just understand what they're going through and how to cope with the challenges that have come with the change of the funeral arrangement that we are seeing. Because at the end of it all, if it's not taken care of, we are going to have a whole lot of people suffering mental illnesses.
Well, Edith, let's not forget the healthcare workers who are doing an amazing job in the country. Even the government has really commended them. Of course, they're coming into contact with situations where they might see someone who has lost their life. They're also putting their lives on the line, and even the lives of their families on the line as well, because of this contact with different patients and whatnot. How can they deal with the situation as it is? I mean, so that they also remain in a place where they have a good mental status that allows them to continue being productive?
Oh yes, I want to start by really appreciating our health officials and health practitioners for the good job that they're doing, but also to put in consideration what you've said, that they're also facing the burden, because they're equally human beings and they're seeing what is happening as much as they want to help. For me, I'll say it is important to know yourself. Self-awareness is very important. That as I provide service, I'm also a caregiver. As I provide service, am I aware of my body? Am I able to pick out and say that I'm getting burnout? And then you'll be able to seek for help. Another thing is during this period, you're able to maybe, shifts, able to manage shifts, and the time you're free, be able to relax, be able to take a good break, ensure that they get healthy diets, be able to at least get a sleep, even if not for the recommended time period, because of the nature of their job, just to have time to sleep for the body to rejuvenate. I also want to say that it's not a sign of weakness to show that you need a break. Many people would say that if I take a break, I show that I am weak. No, it is not a sign of weakness. People should take a break and just relax, and then as they go back to work, they're strong enough. There is a provision for supervision, especially for counselors. We do offer supervision to caregivers. I'll say that if mental for our doctors, our nurses, they would seek for supervision so that they're supported where they are. We have counseling services, although these services are seen as for people who are in their need. I'll say that this is the time that other professionals will want to embrace counseling, so that they're also able to be supported.
Okay, Edith, before we even come to a close of this discussion, I know as we talk about what we can do in the house, and of course the World Health Organization has equally talked about, what people can do, not feed yourself with too much information that is negative, make sure the information that you're getting is from a credible source. Yes. But I think the question now would be, how much of this information can we take in, Edith? I need to know what's happening, but how can I limit this information? Because every day there's always a story of a new case. And today we had another case of a new death, which is very sad news. So how much of this information should we take in?
Yeah, I appreciate that it's important to be informed, to stay updated, but also it is important, as you say, to limit or minimize use of this information, consumption of this information, because this information is not very good information. We call it bad information. Bad in quotes, because it's talking about disease, it's talking about death cases and the rising rates of all these sort of issues. So it is a constant feeding of your mind to bad news in quotes, has its own implication on the person. For instance, it affects our perception. Because if I constantly watch and listen to the news about what is happening, it makes me look at the world in another perspective.
So Edith, how can we regulate the information we are taking in? How can we regulate?
So how to regulate it all depends on the individual, because now it should be a discipline. You need to be disciplined enough for you to be able to regulate. We have all these gadgets in our hands, and therefore it may not be possible to say by 7 you have to watch by this time. So I think people would have to be disciplined enough to know the reason why this excessive consumption of such information is harmful to their health. Because if you set your program that for a normal day when you're working before COVID, we will minimize use of social medias because we are busy working in the offices and attending to our businesses. But now that we have time in our hands, we are free. People are now consuming a lot of this information because they have nothing else to do. So we're able to come up with alternatives, what is it that we can engage ourselves, ensure that we are busy enough, prioritize what we are doing so that we don't have excess time to watch these news that somehow it is affecting us psychologically. So it's a matter of discipline.
And finally, as we come to a close, I know that right now it would be next to, a bit difficult for someone to say they're going to come for counseling services personally to you, because there has to be that sense of social distancing. So are these services available in any other way? Like if someone is going through depression or stress or worry or anxiety, is there a way they can access counseling services at this moment? As we come to a close, keep it short, please.
Okay. Yeah, I'll say that counseling services are available, and especially during this period, we are offering online counseling, and it is quite effective and short. As in, it is crisis oriented because we are addressing issues that are happening now. So the online counseling is really working. Why people are now embracing online counseling, because it's more accessible. Now we're able to reach people that would not have reached the normal or the traditional way of counseling, the face-to-face. So it's more accessible to many people. People are able to call in and be assisted. I would say that it's quite convenient. A lot of people also fear from just coming to show themselves, the stigma associated to coming for counseling. And therefore with this, it's quite convenient because you don't know the face behind the person calling, and they're able to get the services and be supported in the right way. And I can also say that it's quite affordable compared to the traditional way of counseling, the face-to-face, because it is affordable to both the service provider and to the client receiving the counseling services. And all in all, after these sessions online, we're even able to do referrals to the respective people that are able to support our clients even further for assessment and further management.
All right. Thank you so much, Edith, for your time. Always a pleasure to have you on New Week and all other programs that we are able to have you to share your wealth of knowledge on all matters mental health. Thank you for your time again, Edith. Well, that has been Edith Sakwa, who is a counseling psychologist. We hope tonight's discussion has been able to shed light on how you ought to conduct yourself and, of course, protect your mental status at this moment. Of course, again, this has been New Week. I am going to say very much thank you to everyone who has been watching. We may not even have much time to sample all your comments, but I will say this, in case you need Edith's contact, you can actually engage. TV47 will be willing and sure to help you where you need help. Thank you again for watching. My name is Leangare, and our sign language interpreter tonight is Anne Wairimu. This has been New Week. Until next week, same time, same place on Monday for New Week. God bless.
The coronavirus pandemic has not just infected thousands of people around the world. Sadly, thousands of people have also lost their lives.
The virus is here in Kenya, and unless we do something about it, thousands may die.
Our healthcare system cannot bear the burden of this virus.
If too many